Hello everyone, we will learn the supranuclear infranuclear facial palsy. So let's start. The facial nerve has two nucleus, the upper motor neuron and lower motor neuron. This is upper motor neuron and the lower motor neuron which lies in the pons. And upper motor neuron is the motor cortex. Now see the arrangement of fibers. The upper motor neuron supplies the ipsilateral lower motor neuron, its upper half, and contralateral neuron is upper and lower half both. So ipsilateral upper motor neuron supplies the ipsilateral upper half and contralateral upper and lower half. Similarly, opposite side UMN supplies the ipsilateral element its upper part and contralateral element its upper and lower part. Now the element supplies the facial muscles. So let's see the arrangement of exotic fibers of the lower motor neuron. The upper half of element supplies the upper half of face and lower half of element supplies the lower half of face. So upper half supplies the upper half of face and lower half supplies the lower half of the face. Now see the lesions. So in UMN lesion, this fiber gets affected. This both get affected. So let's see the which nerve supply gets affected when there is a UMN region in the motor cortex, like in case of stroke, any tumor or any region which is affecting the upper motor neuron. The fibers of the upper half of element getting affected, but the upper half is supplied by the opposite UMN. So upper half of the lower motor neuron has a dual supply which is supplied from the both side of UMN. So this part is paired, so this will be intact. But this contralateral UMN also supplies the upper half of contralateral and lower half. So this nerve supply also affected. So this will affect this part. So lower part is affected. So in UMN lesion, contralateral half is affected. So let's see the lower motor neuron lesion. If lower motor neuron is affected, this part is getting affected. So supply to this part is affected and also supply to lower part is, so half of the face is affected. So in LMN, ipsilateral half face is affected. So the commonest cause for LMN lesion is Bell's palsy. So let's revise. UMN lesion, UMN neuron, upper motor neuron is present in the motor cortex and lower motor neuron present in the pons. So the upper motor neuron of the ipsilateral side supplies the half of the ipsilateral element and opposite half upper and lower, and the lower motor neuron has different arrangement. Upper half is supplying the upper half of face, lower half is supplying the lower half of face. So In UMN lesion, the ipsilateral upper part is spared due to the bilateral presentation. So only contralateral lower half nerve supply is affected, and it presents as the lower half of the face in the form of deviation. But in low element lesion, the ipsilateral complete half of face is affected. So understood? Please like, share and follow my channel for more informative videos.